prostate surgery, whether it's for cancer, like a radical prostatectomy, benign prostatic hyperplasia, BPH for short, or another condition, can be life-saving and oftentimes necessary. However, many men are surprised to learn about the side effects that can come from these prostate surgeries, specifically as it relates to urinary issues and sexual function. This is where partnering with a pelvic physical therapist and making sure you optimize your post-op preparedness ahead of the surgery can really come into play. My name is Dr. Brooke Kolisiak. I'm a pelvic physical therapist who is passionate about helping people optimize their pelvic health. And today I'm going to talk to you more about what you can do to help make sure that you are ready for your upcoming prostate surgery. Let me speak briefly about why the pelvic floor matters after prostate surgery. So the pelvic floor muscles are a bowl of muscles on the bottom of our pelvis that help to support our pelvic organs and are involved in bowel, bladder, and sexual function. And so these muscles are extremely important and kind of, for most of the time, work automatically for us. However, when we have a surgery in the area, we can drastically affect these muscles' ability to do their job, both with the act of surgery itself being a kind of trauma to the area, and that can make the muscles not function as well as they were before, and the fact that we may be removing the prostate or other tissues around the area, and this can in turn lead to the fact that the pelvic floor muscles will have to do more work after the surgery, and they may not be ready for or used to doing this. In addition, we might see some issues with the surgery itself where we get some nerve issues after the fact, which can in turn affect how the pelvic floor is able to function. So it's really important to kind of understand why and how the pelvic floor is important both before and after the surgery, and what might result if we are dealing with some issues in that area. There are really three common post-op issues that pelvic physical therapy can be very helpful for. The first is urinary incontinence. So this is leaking when we don't want to be leaking. This can be with a cough, laugh, sneeze, when we get up from a chair, when we try to lift something, or it can be in a situation where we have the urge to go to the bathroom and we can't quite get there in time. We leak on the way to the bathroom, or we leak as we're pulling down our underwear to be able to void. So all of these situations are examples of urinary incontinence, and oftentimes this can result from injury to the pelvic floor muscles or pelvic floor muscles that are weak and deconditioned and not doing their job well. A second common issue that people typically experience post-op prostatectomy can be pelvic pain or irritation in the area. So again, surgery in the area is a controlled trauma, and this trauma can cause pain and irritation. And some people are left with pain with sitting, or pain with certain activities, or pain that's even keeping them up at night or keeping them from being able to do what they want to be doing. And this pain can be focal right around the perineum. It can head down into the testicles or the penis. It can head back towards the anus or kind of up into the pelvic bowl itself. It can be anywhere in that pelvic area. So especially when there's been that controlled trauma in the area and nerves and other things have been cut and moved around, we can develop pain issues afterwards. And a pelvic physical therapist is a great partner to help kind of get those nerves to calm down, get the muscles to relax, get everything doing what it should be doing so that we can minimize the pain that you're experiencing. The third issue that is most commonly seen post-operatively that we work with here in pelvic physical therapy is erectile dysfunction. So again, the tissues and the nerves are greatly affected from the prostate surgery, and this can affect the body's ability to both achieve and maintain a strong erection. And so when we evaluate and see what the muscles are doing in the area, how the blood flow is going, there are many different treatment options that we can do to help optimize the effect and the function of the muscles in the area to make sure that you can both achieve and maintain an optimal erection. Many people wonder, when is the best time to start pelvic physical therapy related to their prostate surgery. And I'm here to tell you that we love to see people ahead of their prostate surgery, ideally maybe 3 to 4 weeks ahead of time, for doing what we call a prehab evaluation. This lets us get a baseline of what's going on with your muscles in and around the pelvic area. This lets us start to get you some education about what to expect with the surgery and how best to optimize your recovery, especially in those early days. And it lets us get you moving in the right direction, especially if there's some dysfunction already in some of the muscles around the pelvic area. And by doing this prehab ahead of time, being evaluated and potentially seeing a therapist for a couple of visits ahead of the surgery, you really are optimizing the blood flow to the tissues, how well things are contracting and moving, and supporting, and basically your overall function of the muscles and the surrounding tissues, so that that recovery afterwards can go much, much smoother. Then typically after the surgery, it's usually recommended that we kind of lay low and relax for at least 4 to 6 weeks, but this is specific to what surgery you had and your surgeon's recommendations. But after that time, it is important to get back with your pelvic physical therapist to reassess, or if this is the first time you're seeing them, to assess your pelvic floor muscle function, as well as the function of the muscles in and around that area. Because again, surgery is a controlled trauma, and that can affect how these muscles are performing. So we want to get back together to assess what's going on with your bladder function, bowel function, sexual function. Are you experiencing leakage? Are you having trouble with bowel movements? Are you having trouble holding gas? Do you have trouble getting to the bathroom in time? Are you able to achieve an erection? If so, are you able to maintain it? Is it a satisfying erection? Or are you having, kind of difficulty keeping that erection full and being able to achieve an optimal orgasm? All of these things are things that you and your pelvic physical therapist will discuss together, and then evaluate the tissues and muscles around the area to see how they're functioning, and come up with a plan to make sure we address any type of problem areas to get you back to full 100% post-operatively as quick as possible. So you might be wondering what happens in pelvic floor therapy sessions, especially after having prostate surgery. What's involved? So again, after doing the full evaluation, we'll have a better sense of what's going on specifically in your individual situation. But oftentimes, pelvic physical therapy appointments may involve doing different pelvic floor muscle exercises and activities, both kind of in isolation as well as in coordination with other movements and activities that you might be doing on a day-to-day basis. We also might be doing bladder retraining or looking at a bladder diary to assess how your bladder is functioning and if there's different things that are going on throughout the day or night that might be causing bladder irritations or issues. We might be talking about proper toileting technique and making sure that you're not constipated and that you're able to have a good bowel movement. We might be talking through other stretches and doing other stretches and exercises to help optimize the muscle performance of muscles that are close by, like our hips, buttocks, back muscles, and abdominal muscles. We also might be doing scar tissue mobilization or dry needling or cupping over scars to help them get moving better. Or we might be using at our facility our soft wave shockwave machine to help improve blood flow and get the muscles healing faster, the scar tissue healing faster, all to make that healing process go much quicker for you to optimize your recovery and minimize any long-term side effects like bladder leakage or erectile dysfunction or pain. Now, we consider working one-on-one with a pelvic physical therapist, both preoperatively and postoperatively, kind of the gold standard for optimizing your recovery from prostate surgery. However, we know this might not be something that every person is able to do. And that's why we created our free community education course called Prostate Surgery Preparedness Class. This is a free class that we're going to be offering multiple times a year that gives people education on how best to prepare ahead of time for their surgery so that they can optimize the recovery afterwards. We're going to be going through what you can be doing for your muscles ahead of surgery and after surgery, what you can have in your house to make sure that the recovery goes as quick as possible for you and as smooth as possible. We'll talk about pain relieving techniques so that you can minimize any pain that you have with the surgery. All of this is set up there for you to learn all of the best practices that you can to make sure that you are optimizing your recovery from prostate surgery. Now, our first class for this is going to be on June 24th at 7:30 p.m. and it is going to be an in-person class here in our St. Louis clinic. But you can check for information at our website. I'm going to put the link kind of down below here. It's legacytherapystl.com/events. And if you can't make this event or you're not local to us, we do plan to have other events in the future, as well as ones that might be online so that you can watch from the comfort of your own home. So you can check that link. That's going to be both in the description below as well as what I just shared on the screen to sign up and to keep informed of when our next class is. But hopefully you found this video helpful and you are feeling more confident about your ability to optimize your body for recovery from prostate surgery.